All right. Good evening, everyone. Thank you for joining our Men's Health webinar. I'm Preston Brickner. I'll be your host for the evening. Just going to start us off with a few housekeeping items, and then I'll turn it over to our speaker. First off, your attendance tonight is completely anonymous to all other attendees. No one can see your face nor your name. Any comments or questions can only be seen by myself and our speaker. If you wish to ask a question, you'll just need to type it in the chat box. That should be at the bottom part of your screen, not the one that says Q&A. It just says chat and has a little comic bubble there. Go ahead and click on that, and we'll do our best at the end of the presentation to get to as many of them as we can. The presentation tonight with those question and answer periods should be about an hour, and will be presented by Dr. Michael Witthaus. Dr. Witthaus is a fellowship-trained urologist who specializes in reconstructive and robotic surgery, penile prosthetic surgery, and cancer survivorship, with a particular focus on men's urologic care and male sexual health. He serves as the medical director for the genitourinary reconstruction and clinical assistant professor of surgery at the University of Maryland Capital Region Medical Center. His clinical practice focuses on urologic reconstruction with emphasis in robotic reconstruction, urethroplasty, and prosthetic surgery. After graduating from Minnesota State University, Mankato, Dr. Witthaus completed a post-baccalaureate fellowship at the National Institute of Health prior to attaining his MD at Boston University School of Medicine. He completed his urology residency at the University of Rochester before accepting a Society of Genitourinary Reconstructive Surgeons fellowship at the University of California, San Diego. Dr. Witthaus, I know your time is very valuable. I'll turn it over to you, sir.
Thank you. Thank you. We got a little bit of technical difficulties here. The slide share just disappeared. Are you seeing it on your end?
No, if you might want to have to go back down and share again. I don't know why it kicked you. Apologies.
Yeah, for some reason it kicked me out. Give me one sec.
All right, let's resume. Go ahead, sir.
Now we're in business. Okay, well, welcome. All right, so we have a QR code for those who want to visit our website for kind of looking at how we're going to address incontinence and how we can help. So, discussing male stress urinary incontinence, it can be a very complex topic. There are different types of incontinence that you can experience commonly, after procedures, whether it's prostatectomy, a transurethral resection of the prostate, or even a holmium laser enucleation of the prostate. You can run into this issue. So we'll kind of be addressing things from all angles. We're going to kind of stay somewhat more generic, and then we'll be open to questions at the end for more specifics. And so, really the question is what is stress incontinence? And the analogy that I use is, the stress urinary incontinence manifests as an outlet issue. And so when we talk about how we address stress incontinence, we're talking about kind of putting a cork back on the bottle, basically preventing that leakage that occurs with, any movements, coughing, laughing, any exertion. And it's something that affects many, many men worldwide, everything from procedures for the prostate, as well as other different aspects of cancer survivorship. This is something that affects a lot of different guys. And as we kind of go along, you'll see a recurring theme that there are many men who really do suffer in silence as they deal with this. And there are things that we can do that we can help. So looking at the anatomy for males, particularly how the prostate serves to kind of hold that outlet continent, there are two main sphincters. There's the external urinary sphincter, which is located right as the urethra approaches the pelvis. And then after the external urinary sphincter, you run into the prostate. And then that proximal aspect right before it enters the bladder, that's the internal urinary sphincter. And we'll kind of talk a little bit later about how a prostatectomy really does affect urinary leakage and how it eliminates that internal urinary sphincter, and you're reliant on the external sphincter to maintain continence through that process. There's different muscle aspects that can factor in. So as far as pelvic floor physical therapy, with cancer survivorship, after you've dealt with the prostatectomy in particular, can be very important with trying to maintain your continence in that region. In addition to that, depending on the degree of cancer that you're dealing with, radiation can affect how that muscle interacts with the function of the bladder and kind of holding in the urine and keeping yourself dry. So, looking at the different comorbidities that can occur with male stress urinary incontinence, there's different aspects that kind of throw curveballs throughout in different neurologic conditions, different types of pelvic surgery. There are certain pelvic surgeries that affect the nerves to the bladder as well. In addition to that, urethral surgery and typical BPH procedures. And so all of those different curveballs kind of factor into what's going to fit you best and what's going to help you with regaining control going forward. And certainly, it goes without saying that incontinence really does affect your quality of life. And there's different studies that have looked at how that can contribute to depression, certainly dealing with pads throughout the day, the cost of pads, leakage that's occurring when you don't expect it, taking measures, whether with a penile clamp or a condom catheter, and then having an accident and having wet pants at an event. There's nothing like it as far as affecting quality of life. And that's something that we really take into account, and part of what drives our goals in trying to helping with male stress urinary incontinence. And so depending on what approach you take with dealing with prostate cancer, in addition to that, there are some prostatectomies that are done for BPH or benign prostatic hyperplasia that generally are to help you urinate, but you can also result in stress urinary incontinence. And all those different factors that factor in can really affect the quality of life kind of going forward. So about 90,000 radical prostatectomies are performed each year in the United States. And now the continence rates we quote here, it's not exact. Every surgeon is different, but it definitely can vary. I've seen even some studies that get up to 30% risk long-term. Generally speaking, when we start to evaluate after pelvic floor physical therapy and Kegel exercises, where's your incontinence at? Really at the 6-month mark. And then the 1-year mark is really getting an idea of where most people are going to land, post-prostatectomy, after they've dealt with prostate cancer. And they're starting to move into that cancer survivorship category where, they've beaten their prostate cancer at this point. Their PSA is undetectable, but they're having to deal with, pads each day, whether that's 2 to 3 pads a day or whether that's 6 to 7 pads a day. And all of that kind of factors into their quality of life after they've dealt with the initial cancer diagnosis. And so looking at the anatomy of the prostate, just like what we talked about before, as far as the urethra coming in, from the tip of the penis going in towards the prostate, you have your external sphincter right before you reach the prostate. And for a prostatectomy to remove that for cancer, that's removed and that internal sphincter is affected. And so they, generally speaking, prostatectomists are trying to maintain continence as much as possible, but the reality is that they need to take care of the cancer first. And so those margins that they need to take can sometimes affect the internal sphincter and the bladder outlet right in that region. And you're left with a very short segment to provide resistance, or a cork back on the bottle, so to speak, for the bladder. And so then any pressure thereafter is really reliant on that external sphincter and what you're left with after a prostatectomy. And so there's multiple different treatment options for stress urinary incontinence, ranging from anything from, the typical Kegel exercises that you're reviewing with your original surgeon, to pelvic floor physical therapy, male sling options, as well as artificial urinary sphincters. And so we're going to kind of dive into those different options here. So some of the behavioral changes that we approach is drinking less fluids. Obviously, that's not a feasible option, especially as we kind of approach the summertime. But that's the reality of it, is unfortunately, some of those behavioral changes can help if you have an event. Planned restroom breaks, and that's called timed voiding. That can help maintain a low volume in the bladder and give you a little bit more control. Unfortunately, that can only get you so far, and that's when some of the other interventions come in with pelvic floor physical therapy and kind of retraining the pelvic floor to give that additional resistance at the bladder outlet, at the external sphincter. And part of that are Kegel exercises that you can do really at any point in time during your workday. And there's a method called biofeedback where you can actually train yourself to recognize when you're going to be at the highest risk for leakage. Now, coping with all of that with pads, I don't like to use the word diaper, but that unfortunately that's kind of the scenario that oftentimes we kind of lead into is the cost of the briefs to kind of take care of the leakage. Catheters, penile clamps. Penile clamps are very reasonable, can be found online for very variable cheap prices. But the reality is that they're not very comfortable. They're very useful for events like weddings and things like that while you're trying to get things under control. But oftentimes it kind of falls short as far as improving your quality of life. So that leads us into kind of looking at the Advanced XP male sling system. And so this is a long-term solution. This is a surgery, and it's to treat really mild to moderate stress urinary incontinence. And where that lies is anywhere from 1 to 3 pads per day of urinary leakage. And it's a minimally invasive procedure, generally takes about 45 minutes. It's an in and out same day procedure. In general, it works very well to kind of restore that continence, kind of give you that additional resistance where we were talking about before, where you only have that external sphincter to kind of bring everything together and hold yourself continent. And so, there are multiple different studies that report good outcomes. Generally speaking, a reduction in pads by 77%, as a general gestalt. There's many studies that show that the satisfaction rate is in the low 90 percentile. Success rates in general for anywhere from 1 to 3 pads is quite high. The nice thing about this is that it's a finesse procedure compared to what you've already been through with the prostatectomy. And the recovery is generally fairly quick, well tolerated, but just like any other procedure, you're going to have risk of bleeding, infection, and damage to nearby structures. But that being said, those risks are fairly low. And so really it's about what fits you best. And so specifically how the sling works is it works similar to a hammock in the sense that an incision is made just beneath the scrotum and above the anus, and the dissection's carried down to the urethra right there at the midline. And the sling device is actually placed through the obturator canal, wrapping through and lifting up the urethra, just like a hammock. And that lift provides a kink within the urethra to give you additional resistance to help with your continence. And so in one particular study, about 88% of 79 patients surveyed recommended the sling procedure to a friend. Generally speaking, most prosthetic surgeons will tell you that we're going to make you more dry, but we can't guarantee that we can make you completely dry. And so there's different factors that kind of come into the success rates for these. And certainly those behavioral measures combined with the sling can give you the best outcome. Another long-term solution is the artificial urinary sphincter, or in other words, the AMS 800. This has been around since the 1980s. It's actually been the gold standard for quite some time. This is a little bit more involved, but the nice thing about it is that being the gold standard, this has the highest probability it's going to get you completely dry. And so it is a prosthetic device similar to the sling. It is a same-day procedure, generally speaking. Takes about an hour, hour and a half. And it's an in and out procedure. Just like the sling, it's a finesse procedure, nothing compared to what you went through for your prostatectomy or other prolonged surgeries. It's very discreet in that it's a device that's within the body that nobody knows that you have. And it really essentially mimics the function of your normal sphincter. And I'm going to show you some diagrams here in a second about exactly how it works. The one caveat to this is you do need some good hand dexterity, because to allow yourself to open your sphincter to urinate, you do need to have the ability to squeeze the device to open to empty your bladder. And so specifically, how it works, as you can see, there's 3 main aspects of the artificial urinary sphincter. There's the PRB, or the pressure regulating balloon, and that holds fluid within the reservoir up above. You have your control pump in your scrotum, and then you have the cuff around the urethra. And again, this is all within your body. It's all done through 2 incisions, one in the perineum, which is beneath the scrotum and above the anus, and then the second incision is just above the pubic bone, either on the left or the right, depending on any other prosthetic plans or things like that. They can be placed in the midline as well, but all of which is below your belt line and hidden. And so, the way that it works is that cuff is active and holding the urethra tight to keep urine within the body at all times. And when you need to urinate and you're at the urinal, you can actually hold your control pump, and no one knows that you're necessarily holding it because this is going to be the normal position you're going to be at the urinal, and you squeeze the outer edge of the device to cycle the device, and that will open the cuff so that you can urinate, and it shifts the fluid up to the reservoir temporarily. And this allows you to have complete control in that if you are not quite empty, you can always hit the control button again. But this is going to naturally shift the fluid back after about 50 to 55 seconds, shifts the fluid back to the cuff so that you have continence again afterwards. I'm going to play an animation video here that just kind of goes over everything that we just talked about, because it may seem complex, but this has been around a very long time. There's a reason it's been the gold standard. And so, the approach that we just talked about is the control pump is right there in the scrotum, accessible, usually placed on the dominant hand side, and the cuff is inflated at all times to maintain the continence till you have to urinate. And when you urinate, the cuff will open to allow you to empty, and then it eventually shifts the fluid back so that it can actually close and regain your continence and regain your control. Now, this is particularly gold standard if you have 5-6 pads a day kind of usage that you really want to get more dry. But in addition to that, it does give you a kind of a foolproof method that if you are at 2 to 3 pads a day and you absolutely need to be dry, it can sometimes be a better option than the male sling. So as far as what to expect for the procedure, again, in and out procedure. Generally speaking, it's going to be anywhere from an hour to an hour and a half type procedure. Small incisions. This is a finesse procedure, and it's more about perfectionism than anything else. And then as far as regaining your recovery time and things like that, and regaining your strength afterwards, again, nowhere near what you've been through already through prostatectomies. Oftentimes you're going to be recovering very quickly. Oftentimes I have to counsel patients that they really need to take it easy, hold off on the yard work, hold off on any heavy lifting for a period of time, just because of the risk of any herniation or anything like that. Generally speaking, you're going to feel well. Most people just use Tylenol and ice. They don't even need any opioids. As far as the activation of the device, because you're a little tender afterwards, we keep the device deactivated. And then once you've fully recovered and that tenderness has resolved, then we activate your device to allow you to gain your continence. And so patient satisfaction for an artificial urinary sphincter is quite high. There's 90% of surveyed patients report long-term satisfaction. 90% plus will say will recommend this and will recommend that they would recommend it to a friend. And this is pretty consistent. This is why it's the gold standard, pretty consistent across most studies. It has good long-term results. Because it is a device, it does have risk. But generally speaking, the positives tend to outweigh the negatives. And as far as cost coverage is concerned, most insurance companies, including Medicare, will cover the device. They recognize that stress urinary incontinence is very important to be managed for your health, and it's fairly rare to have this refused by an insurance company. And so if you were to ask some patients, as an example, I'll just read this out. It took me from 9 pads a day to 1. I wear 1 pad because I like to laugh. It makes me feel like I can do the things I want to do with the confidence of not having to worry if I wet on myself. And so, it's really about, making yourself more dry and doing everything we can as safely as possible to get you to where your quality of life is improved. Especially in the circumstance like Herschel here, where he's a cancer survivor. And part of his life that he lost with having to deal with so many pads, that can be pretty detrimental for dealing with prostate cancer. And so, this can be a life-changing option kind of going forward. So the intended benefits for SUI treatment in general, this is about achieving more control over your bladder and reducing leakage to improve your quality of life. And so that allows you to be able to urinate when you want to. And then in addition, this is all placed within your body. Nobody knows that you necessarily have it. It's been around for quite some time. You're not going to get stopped at the airport security line to be evaluated. This is something that people are aware of, and oftentimes even wear a medical bracelet to show that they have it. And there's certainly a high patient satisfaction rate. And the goal is really to just try and get you as close to where you were prior to your cancer diagnosis or prior to your other surgery as possible, and really maintain that confident self that you had prior. So there's risks just like any other procedure. As far as the artificial urinary sphincter is concerned, the device can malfunction. Given that it is a prosthetic device and it functions with hydraulics, there can be pump issues, there can be leakage of fluid, things like that. That is pretty rare. It's less than 1 to 3% per year. So that averages out to around 10 to 15% malfunction rate after 10 years. But again, that's 85 to 90% that are functioning well at 10 years. Generally speaking, I've seen some of these last as long as 20, 25 years without needing to be removed and replaced. Some of the other risks that can occur, especially if you've had radiation or you've had any urethral stricture repairs, is that you can have erosion into the urethra with the cuff. An unfortunate issue that can arise. The revision surgery would be purely if there was some type of malfunction or any concern that you could be more continent. If there's any concern with the original approach, urinary retention can occur, especially in the initial days after the surgery, purely just from the inflammation and swelling, after the procedure. Infection, pain, and soreness. Generally speaking, the infection rate is very low. We take that very seriously, given it's a prosthetic, because if it gets infected, the whole thing has to come out. And so measures are taken to make sure that there's broad spectrum antibiotic coverage for the procedure, and we do everything we can to reduce the risk of infection. And generally speaking, the pain and the soreness resolves within that first few weeks. At most persists to 4 weeks, but usually by 6 weeks, it's resolved completely. The risk for the sling, the sling can sometimes not meet your goals. And the nice thing about the sling is if it doesn't meet your goals, there's still an option for an artificial urinary sphincter after to try and regain your continence. Anytime you get a male sling, you run the risk of urinary retention as well, post-operative pain, the typical risks of bleeding, infection, damage to nearby structures. A lot of the press that slings in general get is oftentimes in the situation where it's a female sling that's placed vaginally, whereas a male sling, it's placed through the skin, and so you're not going to see the infection rates as well as the erosion rates that you do with female slings, which is something to take into account. Is that this is usually in the high 90s success rate. And erosion rates are really quite rare. There can be some irritation, just mostly because of the surgery and its location, but otherwise it's very well tolerated. And so, as far as a summary and where to check out more of this information, is Boston Scientific has some excellent literature and excellent interactive websites. There is an advertisement for what's called Dry, and it's really just focusing on patient experience and doing everything we can to reach out to men who are really suffering in silence, dealing with this, and how we can help. And the known side effects of prostate cancer treatment is unfortunately stress urinary incontinence that can occur. There's certainly a variety of different options that you can pursue to treat it. The different treatment options, depending on what fits each individual, is what's important. Not everybody needs surgery. If your leakage is not bothersome to you, it doesn't mean that you necessarily need surgery. The reason to pursue procedures is if it's bothersome to you and you want to become more dry. And so the sling and the AUS offer some excellent long-term solutions with proven data over many years. And so certainly speak with your urologist to understand your different options. And then thereafter, talking with a prosthetic surgeon can be very useful, because having a perspective of someone who actually does the procedure can be the expertise that you need before you make your final decision. Okay, so here's some of the safety information. This is just for prosthetics in general and making sure that we recognize these are foreign bodies that the body incorporates as its own, but there's inherent risk with all of those. Here's some references.
Awesome. Great job, Dr. Witthaus, as always. Thank you. Everybody, just to reinforce, if you want, your questions are completely anonymous. Only Dr. Witthaus and myself will see them. Go ahead and type them in the bottom of your chat screen there. And